I was asked to think about presenting this subject quite a long time ago, and of course before the events of the last year. So it's going to take my talk's going to take two sort of directions. One is to say a few things about that reflection, and the other one is actually to take a different stance and reflect on it now that we've been through the pandemic and that we're still in the middle of that. I've had a long career as a cancer nurse, and this conference and the International Society of Nurses in Cancer Care goes back 40 years. It's very interesting to reflect. I didn't go to the first one, but I joined conferences early in my career. And, 40 years ago, it's interesting that the themes are not that different. The important contribution that nurses make to cancer care, how to sort of promote an increased emphasis on quality of life, how to prepare individuals who have cancer to cope with cancer itself and its treatment, and the changing pattern of living with cancer. Now, these are all themes that are completely as relevant today as they were back then. And I think that we're still pursuing it. But now, 40 years on, things are very different in the sense that, the survival rate for cancer is very different than when I started as a cancer nurse. Then it was the median survival for cancer was something like a year. Now it's at least 6 years. It's more than doubled in that period of time. And it means that now we focus a lot more about the longer term, about life after cancer treatment, and how we prepare people for that different kind of life that they lead, and how to get back to normal life or a somewhat altered life, depending on what cancer, the disease and its treatment have sort of directed at people. So I'm just going to say a few things about that. And then I wanted to turn to but we've been through this year that has just disrupted that whole sense of what healthcare is about, or what our lives are about, how we're managing as professionals, and reflect on that. I now don't work day to day as a cancer nurse. I'm a Pro-Vice-Chancellor responsible for research and knowledge exchange and links with business for a large research-intensive university in England. So I sort of bring that perspective of a nurse to that. But I've had a very different year from many of people at the conference, where they've been managing, healthcare and cancer care on the front line. But nonetheless, it's been a hugely disrupted year. So I wanted to reflect a little bit on that and what it's taught me about leadership. And I think what it's also saying about, as we come through the other side of that, what the voice of nurses and nurses working in cancer care needs to be in order to recover healthcare, lives, and very specifically recover the disruption to that journey of change and development in cancer care and cancer support has been, given that that's also been pretty disrupted with everything that's going on. And what a powerful voice as leaders we can have, I think, if we give voice to that. So that, in a nutshell, is kind of what I'm going to say tomorrow. It'll be a bit longer, and I hope we have a little bit of a chance with people who are attending the conference to sort of discuss it.